Hi, good evening. My name is Sally. I did my interview with a patient named Jason. He's 58 years old and he suffers from schizophrenia, depression, and anxiety. I'm just going to give a small rundown of the interview. For occupational history and experiences, he used to be a mechanic for 25 years and he works at a shop. But he said that because of his anxiety, it kept getting worse and he couldn't focus anymore, so it becomes too much and then he stopped working. And he said that he has not worked for 5 years now. So for daily routine and roles, so he wakes up at 9 to 10 a.m. in the morning and he'll stay in bed, he said, but then he'll wake up and watch TV and then he'll get something to eat. So for social participation in a relationship, he has a relationship with his ex-wife and his daughter, but he says that his daughter takes him out to some appointments, but he doesn't see his daughter like he as much he would want to. But his daughter goes see him twice a week to take him to those appointments. But he said he would like to see his daughter more, and have a better relationship with his daughter. For mental health impact his daily life, he his mental health is impacting his ability to do his daily activities like getting out of bed, going out, being able to care for his place, being able to care for himself. Because of the depression, he stays in bed, and the anxiety makes him very scared to go out in public. He says that when I get paranoid, I feel like everyone is against me, so he doesn't like to go out in public because of that. He says he doesn't like big crowd because it gets him even more anxious. Okay, some of the screening and assessment tools we can use. For schizophrenia, we can use the positive and negative syndrome scale. It helps to assess the presence of severity in schizophrenia symptoms. For anxiety, we can use the generalized anxiety disorder 7. So it's a quick self-report measure for assessing anxiety level. For depression, we can use the patient health questionnaire 9, commonly used to screen for depression symptoms. And we can use the Canadian occupational performance measure. It measures the client's self-perceived performance and satisfaction in various life area. For number C, how has this person routines and occupational performance changed over the years, and how this person has fluctuations in their mental health? If so, how? Can this person identify effective strategies that have helped maintain stability? So over the years, Jason's routine and occupational performance have significantly declined due to schizophrenia, anxiety, and depression. He was previously a mechanic and enjoyed working in cars and going fishing. He has not been working for 5 years now and struggle with basic daily tasks. Primarily, he just kind of sit there and watch TV and avoid meaningful activities and going out because of anxiety. He avoids social skills. So fluctuation in mental health. Jason experienced worsening mental health with increased anxiety and depression. These issues has led him to social anxiety and paranoia, diminished his ability to cope with stress and manage his symptoms effectively. Effective strategies to maintain stability. So he does receive a mental health therapy twice a week, and then that would help him and support him in coping strategies for managing his anxiety and depression. Social group participation, he does goes to social group, so that helps reduce feelings of isolation, even if he feels uncomfortable. But he does go to social group. Family support. Of course, he does have his daughter and his ex-wife support, and they do encourage him, and this is a connection for him to get back and engaging in activities that he likes doing. Okay, for the next question, what are the key social and environmental factors that have contributed to well-being, and how can these factors be used to support progress towards wellness? Critical social and environmental factors that contributes to Jason's well-being includes support networks, positive relationship with family, such as his daughter and his wife, and mental health professionals provide emotional support and encouragement. Engaging with these networks can help reduce feeling of isolation and improve his sense of belonging. Structured environment, a stable, organized living space foster predictability and alleviating anxiety. Implementing routines and clear expectation can help Jason feels more secure and in control. Community resources, access to community programs, support groups, and recreational activities can enhance social engagement and provide opportunities for skill building. Encouraging participation in these activities can promote socialization and reduce stigma. Healthy lifestyle choices. Jason reported that he cooks, but he often eats a lot of junk food. Helping him access nutrition food, safe exercise environment, and opportunity for physical activities can significantly impact mental health. Encouraging healthy habits can improve Jason's physical and emotional well-being. For question F, based on your interview, provide at least 2 evidence-based intervention tailored to the individual to improve quality of life and overall occupational performance. Please consider the individual strength. Based on Jason's interview, here are 2 evidence-based intervention tailored to improve quality of life and overall occupational performance while considering his strength. I would use the cognitive behavior therapy techniques, which is the CBT. It effectively address anxiety and depression by helping individuals identify and challenge negative thought patterns. For implementation, I would do the cognitive restructuring, assist Jason in recognizing and reframing negative thoughts about self-care tasks such as hygiene, grooming, and grocery shopping. For the second one, I would use behavioral activation for self-care, hygiene, and leisure participation. For behavior activation, it focuses on increasing engagement in meaningful activities to improve mood, manage mental health symptoms, and improve overall well-being. Implementation, I would do daily routines, develop a structure schedule for specific times for self-care tasks, including meal preparation, grocery shopping, personal hygiene, and grooming. So with Jason values his family. So regarding family, we can integrate it by involving his daughter in activities such as cooking and shopping. His past enjoyment of hobbies can motivate him to engage in meaningful leisure and perform personal care activities. For question letter G, what are some ethical and cultural competence principles you feel you should keep in mind as you plan to and implement intervention to support well-being? Respect and autonomy. Always prioritize Jason's right to make sure you inform decisions about his treatment. Encourage him to express his preferences and actively involve him in setting goals and developing interventions. Beneficence and non-maleficence. Focus on promoting Jason's well-being and preventing harms. Interventions should be designed to enhance his quality of life while being sensitive to his mental health challenges. justice, ensure equitable access to resources, services, and support for Jason, considering any barriers he may face due to socioeconomy, status, location, and other factors. Advocate for his needs and help him access community resources to support his recovery. Confidentiality. Maintain Jason's privacy and confidentiality regarding his mental health and personal information. Cultural awareness. Recognize and respect Jason's cultural background and personal experiences. Understand how these factors may influence his views on mental health, self-care, and occupational performance. It is important for us to tailor interventions, customize interventions to align with Jason's culture, values, and belief, ensuring that they are relevant and acceptable to him. This may include integrating family involvement or considering his social background. For question letter H, are there any additional stakeholders you may involve to an intervention to support well-being, and if so, how? Yes, involving additional stakeholders can significantly enhance the effectiveness of interventions to support Jason's well-being. Here are some stakeholders and how they can contribute. Mental health professionals collaborate with psychologists and psychiatrists can provide comprehensive mental health support. This can include regular therapy sessions, medication management, and crisis interventions. The benefit of this is their expertise can help address Jason's and the underlying mental conditions and ensure that the treatment plan is holistic and effective. For family members and or caregivers, engage family members or caregivers in interventions process. Provide them with education about his condition, strategies to support him, and ways to encourage his participation in activities. The benefit of this is involving the family creates a support home environment, promote understanding, and help reduce feeling isolation for Jason. Community support. Connect Jason with local community programs such as group support, recreational activities, or vocational training that align with his interests and strength. And the benefit of this is these services can offer additional resources, foster social connection, and promote engagement in meaningful activities outside of therapy. For social workers, involve social workers to address any socioeconomy barriers Jason may face, such as access the resources, housing, financial assistance. The benefit of this is social workers can advocate for Jason's needs, help him navigate community resources, and ensure he receives comprehensive support. For peer support, engage peer support who lives and experience mental health challenges to provide Jason with relatable support and encouragement. The benefit of this is they can offer valuable insight, sharing coping strategies, and help Jason feel understood and less isolated in his journey. For question letter I, reflect on your interview skills and use of therapeutic use of self through the interview process. During my interview with Jason, I focused on several key skills and therapeutic use of self. Active listening. I ensured Jason felt heard by giving him full attention, using verbal affirmations, and encouraging him to open up. Empathy. I showed understanding and compassion, helping him feel comfortable discussing his mental health challenges. Open-ended questions. This encouraged Jason to elaborate on his experience, helping me to gather deeper insights for his occupational profile. Non-verbal communication. I use warm, open body language to build trust and rapport. Culture sensitivity. I remain aware of his cultural background and how it might influence his views on mental health. For the last question, based on your interview, what has been the most significant lesson or insight you have gained and which can apply to your personal or professional life? How might this lesson shape how you work with individuals living with mental health? The most significant insight I gained from interviewing Jason is the importance of patience and empathy when working with individuals with mental illness. Jason experiences schizophrenia, anxiety, and depression revealed how deeply mental health can impact daily life and occupational performance. Regarding the complexity of his struggles, he has reinforced the need for holistic and client-centered approach and therapy. This lesson will shape my professional practice by reminding me to always approach clients with understanding and without judgment. It will encourage me to focus on building trust and providing a safe space for clients to express themselves. I'll also be more mindful of pacing interventions, ensuring they align with each individual's comfort level and readiness for change. Ultimately, this insight strengthens my commitment to provide compassion care that acknowledges the unique challenges faced by those living with mental illness.